So this video got 4 million views and it's showing a skin tag removal that you can do from home. First of all, it's very tough to remove skin tags like this, so don't believe everything that you see. But in this video, I'm actually going to talk about skin tags and exactly what is the proper way of removing them, and using a rubber band around the skin tag is not the proper way. So my name is Dr. Swati Cannon. I am a cosmetic dermatologist as well as a skin cancer surgeon out here in California, and I want you to watch this video so you can learn about skin tags, how to properly remove them, and when to be concerned. Like, when is a skin tag not a skin tag? What exactly are skin tags? The scientific name, or the dermatologic name for skin tag, is called an acrocordon. I don't know why we have so many difficult names in dermatology, but that's how it is. So they are soft, small, little fleshy, benign growths, and they kind of have a little stalk. Some of them have a stalk, and so they hang a little loose, and some of them are flat and don't have a stalk. They are typically skin colored, or they can also be darker, and they are composed of these loose collagen bundles along with blood vessels and are surrounded by skin. So that is what a skin tag is. We can get skin tags technically anywhere, but the most common places include areas of friction. So the neck, armpits, groin, inner thighs, and then also our eyelids. Why we get them on our eyelids, we don't really know, because there's not much friction unless you're rubbing your eyelids all the time, but they are also very common on the eyelids. Who gets them? Well, all of us can technically get skin tags. I even have skin tags like on my neck and in my armpit that I need to get removed. Genetics and family history definitely play a role. So if your parents or grandparents have a lot of skin tags, there's a chance that you might get them too. But usually as we get older, so the middle-aged and the elderly people tend to have more skin tags than the younger people. If I do see skin tags in very young patients or children, then I do get concerned about some genetic syndromes. Now, these genetic syndromes are incredibly uncommon, but as dermatologists, we do want to rule out the worst possible scenario. And so if I see skin tags in very young patients, I might send them to a geneticist if I see other stigmata of that condition. But in most individuals, especially starting in our late 20s and older, it's very common for us to get skin tags. Pregnant women or people who are on hormonal replacement therapy, either with estrogen or birth control pills, you can get skin tags as well. When you're done with these hormonal changes, though, the skin tags don't really go away. They just kind of stay there until they're removed. And then patients who have insulin resistance. So there are certain conditions that cause your body to be resistant to insulin. This includes polycystic ovarian syndrome, diabetes, prediabetes, and metabolic syndrome. So insulin is a hormone that is released by your body when you consume glucose or sugar. The insulin is released so that your cells can absorb the sugar from your bloodstream. But when you have insulin resistance for a variety of different reasons, your cells within your body cannot absorb that sugar. And so you have higher levels of insulin in the blood and higher levels of glucose in the blood. This then sets off a cascade of events leading to cell growth. And so high insulin, high glucose levels are, technically can contribute to cancer formation within the body, but they also contribute to skin growths, one of them being skin tags, and then the other condition called acanthosis nigricans, which is when you get these velvety patches in your armpits or your neck, for example. So these are the first two signs of insulin resistance, and these can occur even before you have a diagnosis of diabetes. Let's say you control your blood sugar levels and your insulin resistance goes away. Well, your skin tags can still stay until they're removed, but that will just minimize your risk of getting more skin tags if your insulin levels are under better control. But your acanthosis nigricans, that does respond to better insulin control. And so certain conditions will respond and some won't. If I do have a patient, by the way, where I see skin tags plus acanthosis nigricans, I will often send them to an endocrinologist for further workup. Or if the patient's super young, if they're adolescent and I'm seeing a lot of skin tags, then I will also send them to workup for PCOS. If I see children with skin tags, that is not normal. So that kind of makes a little light bulb go off in my head. I might ask other questions to see if they have other kinds of growths, because there are certain genetic conditions where children can get skin tags. Do you have skin tags, by the way, or have you attempted at-home removal for your skin tags? Let me know and comment below. Also, if you want to learn about other skin growths or just other things within, skin, hair, and nails, let me know so I can make future videos about them. And don't forget to hit the subscribe button so that you can stay tuned for my latest videos. How do we remove skin tags? Now, At home, people are going to try like dental floss or wrapping a string around the skin tag. The way that this works is that you're just kind of cutting off the blood supply to the skin tag, and which will then kill or necrose the skin tag, making it fall off. The problem with doing this, of course, is that you can get irritation, inflammation, scarring, discoloration. And then if you're choosing to cut the skin tag at home with scissors, well, your scissors are probably not sterile, so you're setting yourself up at risk for infection. That is why it is best to leave it to the professionals like myself. I actually had a patient come in and she had tried removing her skin tag on her neck by using one of these products. It's like these at-home freezing products. All it did was just irritate the crap out of the skin tag and the surrounding skin, which then made her come to see me and we removed it. But just because it's on the medical shelf at CVS does not mean that you need to use it. The way we treat skin tags in a dermatologist office is we have a few different ways. So the first way is liquid nitrogen or cryotherapy. We can simply freeze the skin tag. It will then fall off in a few days. The problem with doing this kind of freezing is that it will also get the surrounding skin, and so we're putting that area at risk of discoloration. You can also dip forceps into liquid nitrogen and take those cold forceps and touch the skin tag. The skin tag will then freeze off and fall off, and it leaves the surrounding skin unharmed. I find both of these ways to be pretty time consuming. The way I like to remove skin tags is to just snip them off. But what we'll do is we'll numb the area with lidocaine injection, and then I will lift the head of the skin tag using the forceps and simply snip off the base. This usually heals within a week or so, and there's no risk of discoloration, or very, very little risk of discoloration in this way. It also removes the skin tag right away, and you don't have any risk of recurrence. If the skin tag doesn't have a stalk or it's kind of flat, then there's not much to snip. And so then I will use a method called EDNC, or electrodesiccation and curettage. This just means that we very gently burn and scrape that skin tag, kind of melting it away. This has a very, very low risk of discoloration and other issues, so it's also one of my preferred methods. Once we either snip it or burn it off, the area that we've treated heals up within 1 or 2 weeks. I usually recommend as wound care is to just clean the area with a gentle cleanser in the shower and then put a thin layer of ointment like Vaseline or Aquaphor so that all those areas heal nicely without any problems. Now, what are some skin tag mimickers? So these include sometimes moles. There are certain moles which are composed of melanocytes, which are the pigment producing cells of your body. And sometimes these can be fleshy and round, and they also sometimes have a little stalk. Moles, you definitely want to get them evaluated by a dermatologist before you attempt removal, because we always want to rule out melanoma for all moles. The other mimickers include something called a neurofibroma. A neurofibroma is also soft and fleshy, skin-colored. It is composed of nerve bundles surrounded by skin, and they can be sensitive to touch or pressure sometimes. While neurofibromas are benign, if I see a lot of neurofibromas along with other signs or stigmata, I am worried about a genetic condition called neurofibromatosis, and I may send a patient to a geneticist to work it up if I see all of these different signs. Another lesion called a nevus lipomatosis. This is just a very large skin tag. These are also benign, but they are much less amenable to skin snip removal. So we usually have to kind of excise it so that we can take out the entire root of the nevus lipomatosis. And then a slightly more, I wouldn't say dangerous, but a more concerning mimicker of skin tag is something called the cutaneous horn. So cutaneous horn looks like a horn coming out of your skin, but about 30 to 40% of cutaneous horns have precancers or skin cancers at the base. And so if you just snip this off at home, there's a big chance that you would have missed the skin cancer at the base of the horn. And so again, all of these are reasons why you need to get evaluated and treated by a professional like a dermatologist. A common question is, does insurance cover skin tag removal? If you have a few skin tags that look really irritated or that are getting pulled by your clothing, then some insurance companies will cover removal of them. But if you have a lot of skin tags and we're removing them because you don't like the way they look, well, then those are not covered by insurance. The cost for skin tag removal varies based on the number of skin tags that you have and where in the US you're located. So usually the cost is a few $100s. It's best to see a dermatologist for an evaluation and consultation. So most patients who have skin tags, they also tend to have other benign growths. And some of these growths kind of look like these, and they are rough and often really just as annoying as skin tags. So if you have these, make sure you watch my video on seborrheic keratosis next, where I go over what they are and how to treat them. Thank you so much for watching this video. Make sure to subscribe to my channel, and I will see you in the next one.